friends, I'm Megan, and I'm here to share with you a little bit of information about polycystic ovarian syndrome, also known as PCOS. I'm 34, but when I was just 25, I was diagnosed with PCOS. When I share with women my experience with PCOS and my diagnosis, I often get confused looks. And I also get questions like, what is PCOS? What does PCOS stand for? What does it do to your body? Is it painful? And is it contagious? This had me realizing that PCOS is often heard about, but it's not often talked about. So today, I'm here to give you some friendly education about the symptoms of PCOS, treatment, and the consequences of what happens if you don't take care of your body. Women who have PCOS may have enlarged ovaries. The word polycystic means many cysts. These cysts are fluid-filled, and they may be the size of a pearl. Women with PCOS produce slightly higher amounts of male hormones called androgens. These androgens contribute to the symptoms of PCOS. Some symptoms of PCOS is irregular to no periods, excessive hair growth, acne, and obesity. I want to share with you a little bit of my journey with PCOS. As I mentioned earlier, I was only 25 when I was diagnosed with polycystic ovarian syndrome. My doctor really didn't give me a lot of information on what PCOS was, and I didn't care to educate myself. I went about my life thinking, how bad can it really get? Well, with that attitude, I suffered some major health issues throughout my life, such as obesity, acne, excessive hair growth, and right now, infertility. A few years ago, I had to have surgery because I didn't take care of my PCOS. I stopped having periods altogether for about 3 years. I did nothing about it. I didn't seek help, and I didn't educate myself. Because of that, I had to have what was called a D&C because the lining to my uterus got so thick that they had to check for cancer. Thankfully, I was cancer-free. Doctors don't understand the cause, and there is no cure. But early treatment and early diagnosis is the key to reduce your risks of diabetes and heart disease. Thankfully, there is treatment for PCOS. Some treatments include birth control, which keep your periods regular. Ladies, it is so important to have regular periods. Also, there's a medication called metformin. It reduces your risk and helps prevent diabetes. Your chances of getting type 2 diabetes with PCOS, if not taken care of, is extremely high. If you are experiencing symptoms with PCOS, seek help now. Do not wait until it's too late. Do not wait until your body has gotten so out of control. Get the help that you need and get the help that you deserve. I've had PCOS for 8 years now, and I'm still learning to take care of my body. PCOS is a learning process. That's why it is so important to stay educated. And that's why it is also important to talk about it. If you have PCOS, talk about it with other women. Encourage them to get checked. Encourage them to ask their doctors questions. Recently, my husband and I joined the Y. We knew that to have a successful pregnancy, we have to live a healthy lifestyle. Together, we've lost 20 pounds. Having a weight issue with PCOS is hard. It is hard to lose weight, but it is not impossible. Just because you have PCOS does not mean PCOS has you. You can still live a happy and full life. Thank you so much for tuning in today. If you have any questions, please put them in the comments below. And if you have a story to share, share it. Let the world know. Don't be ashamed. PCOS is nothing to be ashamed about. See you next time. Wow, I did that without crying.
Aww, I want tears.
No.